Welcome to the Omnidental Podcast. Today, we're doing a deep dive into a topic that, honestly, a lot of you have asked about. It's that period right after a professional teeth cleaning, what to do, how to handle it, and specifically, how to deal with the risk of a gum infection.
That's right. And we're zeroing in on the more intensive procedure, the deep cleaning. Our mission today is to, really distill the must-knows. What causes an infection? What are the absolute critical warning signs? And what can you do, right away to manage it?
And all this guidance is coming from the fantastic team at Omnidental and MedSpa, right in Arlington Heights, Illinois. They're led by Dr. Billis Poles, who has over a decade of experience, and they really are a hub for so many communities nearby.
They serve Arlington Heights, Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village. They really believe in proactive knowledge, which is exactly what this is all about.
Okay, so let's get right into it. Why would a cleaning, something that's supposed to make us healthier, sometimes lead to an infection? It just feels a bit contradictory.
Yeah, it does, and that's a great question. The key thing to understand is the difference between a regular cleaning and a deep cleaning, which is technically called scaling and root planing.
Okay.
A regular cleaning is mostly above the gum line, but with a deep cleaning, we're going below the gum line into those little pockets between your teeth and gums.
I get the really tough stuff.
Exactly. We're removing hardened plaque, what we call calculus or tartar, from the root surfaces. And that process, well, it has to disrupt the tissue a little bit. It exposes sensitive areas.
So it's not that the cleaning introduces bacteria, it's that it opens a door for the bacteria that are already there.
You've got it. It creates a temporary window of vulnerability, and that's why the aftercare is just so paramount.
And I imagine some things can make that window of vulnerability even wider. The source material points to a few risk factors.
Oh, absolutely. The biggest one is your oral hygiene before you even sit in the chair. If there's already a high bacterial load, you're starting on the back foot.
That makes sense. What about things like your overall health?
A huge factor. A weakened immune system, for example, or other underlying health issues means your body just can't heal those tiny disruptions as quickly.
And smoking was mentioned specifically.
Yes, smoking is a major inhibitor. It constricts blood flow, which means your body can't get the healing cells and nutrients to your gums efficiently. It basically stalls the whole recovery process.
Okay, so this is the really critical part for our listeners. Some soreness after a deep cleaning is normal. So how do you tell the difference between this is normal healing and, uh-oh, this might be an infection?
That is the million-dollar question. You should expect some mild discomfort for a day or two, but there are definite red flags.
And what's the first one?
Persistent swelling or redness. I mean, if it's getting worse after the second or third day instead of better, that's a sign.
Okay, what else?
Bleeding that doesn't stop after a day or two. And then there's pain. Not just tenderness, but, real pain when you're chewing or brushing.
And I think there are a couple of signs that are probably a bit more alarming for people.
Right. A bad breath that won't go away, or a really foul taste in your mouth. That's often a sign of, bacterial activity.
And the most serious one?
The formation of pus or an abscess near the gum line. If you see that, that is not a wait-and-see situation. That requires an immediate call to your dentist.
What about if the symptoms are just lingering? Like, it's not getting worse, but a week later, it's not really better either.
That's a really important point. If mild symptoms hang around for more than a week, or if they seem to get a little better and then get worse again, that's also your cue to call. It means healing has stalled, and you need a professional to take a look.
So prevention is always the best medicine. Let's give everyone that immediate post-cleaning checklist, the top things to do to cut down that risk.
Absolutely. The first one is simple but crucial. Maintain a good but gentle oral hygiene routine. Brush twice a day, very gently, and floss when your dentist gives you the green light.
Number 2.
Rinsing with an antibacterial mouthwash. Your dentist might even give you a prescription for one, like chlorhexidine, for extra protection.
And then there are the lifestyle things. Avoiding irritants.
Yes. This is so important. Stay away from smoking, alcohol, and very spicy or acidic foods right after the procedure. They all irritate healing tissue.
Okay, that's 3. What's number 4?
Stay hydrated. Water is your best friend. It helps flush away bacteria and just generally promotes a healthy healing environment in your mouth.
And last but not least,
eat soft foods. For the first few days, think things like yogurt, mashed potatoes, smoothies, nothing crunchy or sharp that could physically damage the sensitive gum tissue.
that's a great actionable list. But let's say someone is listening and they're thinking, I think I might have an infection right now.
Yeah.
What can they do at home while they're making that call to the dentist?
Okay, number one is make the call. Don't put it off. While you're waiting for your appointment, a warm saltwater rinse is incredibly effective.
How did that work exactly?
Well, you mix about half a teaspoon of salt in a glass of warm water and just rinse gently. The salt creates what's called a hypertonic solution. It actually helps draw fluid out of the inflamed tissues, which reduces swelling, and it also cleans the area.
What about for the pain?
An over-the-counter pain reliever like ibuprofen is a great choice. It's an anti-inflammatory, so it tackles not just the pain, but also the swelling, which is often the source of the pain.
And you should keep brushing gently through all this.
Yes, absolutely. You have to keep the area clean to stop more plaque from building up and making things worse. Just be very, very gentle.
So once they're in the dentist's chair at OmniDental, what kind of professional treatments might they expect?
Well, it depends on the severity. If it's caught early, it might be a course of antibiotics or a prescription-strength mouthwash to get the bacteria under control.
And if it's more advanced?
In some cases, we might need to go back in and do a more targeted scaling and root planing on the specific area that's infected, just to make sure we've removed every last bit of the irritant.
Which all comes back to why that post-procedure care is so vital, to avoid needing more treatment.
Exactly. Good hygiene after the fact helps the tissue heal, helps it reattach to the tooth, and prevents that bacterial rebound.
So I think the big takeaway here is that yes, a gum infection can happen after deep cleaning, but it's totally manageable. The key is knowing the difference between normal soreness and those red flags and acting fast when you see them.
That's it in a nutshell. And it really speaks to the whole philosophy of a place like OmniDental. It's about comprehensive health. We're talking about gum tissue today. But the principles of healing, managing inflammation, staying hydrated, avoiding things like nicotine, they apply everywhere.
So what does this all mean for you listening at home? It means the best thing you can do for your health is be an active, informed partner in your own recovery.
And that actually brings up a final thought. We've talked a lot about avoiding irritants like smoking for gum healing. But OmniDental also offers a whole range of aesthetic services, Botox, fillers, skin treatments.
Right.
So it makes you think, how might the healing process and the precautions needed after one of those sensitive cosmetic procedures mirror or maybe differ from the healing care we've just discussed for a dental procedure? It suggests that this focus on creating the optimal healing environment really is a universal principle across advanced care.
That is a fascinating way to connect it all, a really holistic view of healing. So act on the knowledge you've gained today. Early intervention is everything. If you have any concerns at all, don't wait. You can reach the experts at OmniDental and MedSpa in Arlington Heights at 847-483-8833. Thanks for diving deep with us.